job yesterday. Thank you.
Thank you for joining in.
Good morning. My name is Eileen Turner with the Faith Group.
Good morning. Thank you for joining us this morning, Eileen. We're going to give it about 2 more minutes and let people, log in. I do, with all of this logging in, I do know how it goes, at least for me. You would think it's easier to be right spot on, but I'll click on and click here and get lost. And
Good morning, everyone.
Good morning, Ms. Ramos.
How are you?
Doing well. Thank you for joining us. We'll give about one more minute, and then I'll introduce everything and turn it over to our facilitator this morning.
Good morning. I'm Karen Delisle from Our Lady of Lourdes and Faith, and I am having my roof redone, so I'm going to go on mute. Otherwise, you're going to hear a barking dog.
That's great. Thank you.
Thank you.
Okay. Good morning. We'll go ahead and get started. I would like to thank everyone for joining us this morning for our health and social services discussion, which will be facilitated by Bob Williams, who also facilitated the previous discussion, our listening session. This morning's objective is really to start pushing us towards actionable actions, actionable agendas, and to begin to promote and work towards being ambassadors for this cause. So I thank you all for joining us. I will go ahead and read my script that staff has given me. Recommendations or recommended practices for meeting participation. Your microphone will be muted upon entry. However, you will have the ability to unmute yourself and enable your web camera if you choose to. We do like it when you enable your web camera. It gives a feeling of energy in the room, but we do understand that we have different things going on and folks oftentimes just want to be able to listen. Participants using mobile devices should use the raise hand feature when they desire to speak. Requests to speak are automatically prioritized by the meeting software when the raise hand feature is used. All other participants can exercise control of their microphone and camera. Please mute your microphone when you're not speaking. A meeting technician will use the chat feature to communicate important information. Contact us at equitynitiative@codb.us or 386-671-8203 if you have any problems or issues during this morning's discussion. So without further ado, I will present a gentleman, young man, I will refer to him as, because while he's retired a couple times over, I think he still has the energy of a 20-year-old, and he is a wealth of knowledge and information, and most importantly, overwhelmingly committed to the wellness of our community. And for those of you who are on the call, that's the sentiment that I feel about each of you. Your decision to join us this morning is a reflection of your care for our community and your interest in this issue of equity. So if staff would, I would ask that they go ahead and post our picture. The picture is, while I've heard different opinions and thoughts of the picture, and we know that there are extensions beyond this. For those of you who have not been with us, this is an example of what I refer to as sort of our guiding post. You know, let's just use this as a stick or a barometer, a measuring stick that we can reflect back to as sort of our objective. And that picture, if you notice, gives the young child an opportunity to see the game, to participate in the game. And that's really what I kind of think equity is. While I try not to preach or proselytize about this topic because I think we all have different definitions about what equity is. And we recognize that. I do think we have to have something to look back to that kind of keeps us moving. And so that picture will be there. We realize that there are other pictures that we will share later as we move down the line. But at the end of the day, when you talk about my ambition to make Daytona Beach a model city for equity, that's where it begins for me. We can have discussion about it, and I know there's more things to be done, and I know about justice, but let's begin there. So without further, I will introduce this morning's facilitator again, Bob Williams. Thanks for joining us, and take over, please, sir.
Thank you, Mayor. I really appreciate it. And if the team supporting us would hand over host control to me, I hope you all will indulge me. I put a few slides together. We had an amazing session, listening session, a lot of input from a lot of people. And I was just given host control and my computer is already acting weird. So let me try this, see if this will work. And then the other thing that I would recommend, what you may want to do if you are in the gallery view, you might want to go to the screen view. Now, my question to you is, can you see my PowerPoint screen?
Yes.
We can see it.
Okay, great. Thank you very much. So again, this is, we are here with the focus group for health and social services. And I borrowed a few of the graphics from this mayor's website on this initiative. And, you know, I love this graphic on equality and equity. It, you know, really has helped, I think, jumpstart this initiative, and it gives a good visual to me. As I said, we had an amazing listening session, dozens and dozens of comments. So I went back through and tried to summarize it for the benefit of those of you who may have not been able to join us, but also then in case, you know, there were any key points that really didn't get to come out, and those of you who did participate. And I apologize for that. So I divided them up into 5 major areas, and you know that there's a little bit of a health bias on this because I kind of have been thinking in that way for the last 8 or 9 years since I was serving at the hospital. So let's just kind of go through that a little bit and look at them. And you can kind of ignore the index numbers on the right. That was just sort of my way of tracking where these different comments came from. But so in the first area of systemic issues, there were comments about we need to look at the social determinants of health. We need to look at the political determinants of health, which I had actually never heard of. Systemic health disparities. We talked about implicit bias training, about people from different neighborhoods and demographics getting together and talking to each other more. That's one of the things I've seen in some of the research I've done and best practices that tend to come out of initiatives like that and like this. And actually, any of those of you who may have participated in the mayor and Teresa's business session yesterday, there's already an initiative, and I know Robin is going to help with that to get people from all over the community to come together around a project. And I didn't comment on it at that time, but you know, just doing things together, whether it's getting together to break bread or getting together to do a community project, is just a way for us to get to know each other and work together. Oh, and I see we have a problem already. I'm going to admit Ethan Johnson has just joined. Now that I'm a host, I have to let everybody in. So I'm going to try to get through this as quickly as I can and turn this host responsibility back over to the team at the city. We need a holistic approach, that we need policies that promote equity, community. There was a suggestion for a community impact committee, that we need to work collectively towards solutions and then bring our community resource networks together. So the next section should be health behaviors. So we talked a lot about fresh food, that, 32114 has been called a food desert. Someone used the term food apartheid. I'd never heard that before. Programs for meals for kids. We had some discussion about sexual activity and human trafficking and how that impacts our community. There's a best practice of food drops and healthy food use and preparation training. Not everybody has a full kitchen to be able to work with all different kinds of natural foods. So that has to be considered. And then there was a discussion about people get fed often very readily in disaster relief models. So we talked a little bit about that. Clinical care is another area, and it's interesting, there wasn't a whole lot to say about that. We talked about access to care, but, and it's actually quite appropriate because in population health models, actual clinical care is generally about 20%. I mean, particularly with respect to hospitals, once someone needs to go to an acute care hospital, we've probably done a whole bunch of things wrong already. And so, but having access to care, preventative care, and healthy living, behavior-related care can often be very related to affordability, insurance, and transportation. Some of these other things that we talk about, like in this section on social and economic factors, which I think is where we spent a large part of our time. Obviously, income issues, and when you look at the research on doing statistical analysis on what is the single factor that correlates to healthy communities across our country, and generally it's socioeconomic basis. If you are in a more affluent community, people tend to be healthier. And so, everything that we do around economic development and so forth really impacts our health and social well-being. We talked about seniors having pharmacy access and transportation issue, job programs for teens, the CETA program in the day, which I think is now morphed into the Job Training Partnership Act. We talk about how one of the interesting things on demographics on Florida is so many people, are born and raised elsewhere, and then they come to Florida later on, which generally means that they left behind their families and therefore, don't have that local family network and infrastructure that they might have if they were in some other community. We talked about how many children today are being raised by single parents. The business yesterday we made before this talk about connecting with the other workers in business in general. I'm getting a message that my internet connection is a problem. Can you all still hear me okay?
You're freezing up, Bob.
Okay. If it gets too bad, I guess, Mayor, you can hear me or something. So moving through this, neighborhood issues, education, community. One of the topics was about the community being committed in tithing of our time. And I think in one of the action items that was brought up yesterday about getting together to do a park cleanup, I mean, that's a perfect example of an action. Better jobs in Daytona. We talked about education, that not everyone needs a college degree, and about perhaps job fairs for entry-level opportunities, structuring jobs to support single moms, about making education more affordable, about any issues there might be with substandard schools in poor neighborhoods, And then we talked a little bit about a model program at Turi T. Small, where one of the local Rotary clubs had come and has a long-standing mentorship program for that, and has been very successful at helping those young people move on to high school and go to college. And many of them are now professionals in our community and have come back to give. And so it's been going on for quite a while and been very successful. We also had many comments on the physical environment, and we talked about the connection between our environment and health and services, transportation issues for kids. I mean, you can have community athletic programs, kids can't get there. I know the mayor shared with me a personal story of growing up and how his father used to go to neighborhoods and pick up kids and bring them to the ballpark so they could participate. Affordable housing was mentioned multiple times. Walkable communities were mentioned multiple times, improving our neighborhoods, what we can do with situations where there is substandard housing that can lead to health problems. If you have mold in the house, it can create asthma, which then can lead to absenteeism, which can then lead to more poverty, and it's just a spiral down. And talking about making sure code enforcement is helping with that in the city. And someone mentioned a model program called Tangelo Park in Orlando. I did a little research on that, and it's a very cool thing. I would encourage you to look into that more. So those were the comments that we had, and Mayor Henry then did send out some guidelines for us to think about, and hopefully you all received these and had a chance to really think about, what are your standards for equity, in terms of where you work or where you worship or live. What are the guidelines for equity, and how would you look at those? The mayor brought up the concept of an equity ambassador, and maybe we could talk about what that might be like in this context. And then whatever resources that you might want to share with us today. And hopefully some of you, came with an agenda for what you'd like to cover. My job here is not to direct any of that. I'm here just to help moderate and to facilitate. I really don't have, other than sharing with you what we've said before, that was essentially what I wanted to come with. And again, I wanted to commend Teresa Rand, who did a phenomenal job yesterday moderating the business and media session. And she had a great question, I thought, to kick it off, which was, we can kind of go around, and if you would identify for yourself, what is your standard of equity, and how does that relate to you personally? And again, yesterday it was interesting. We really talked about a lot of different aspects of equity, not just racial equity. We talked about religion, we talked about gender, we talked about age equity. And so, there could be a lot of things. So with that, to the team at the city, you can now take back over host control. And let's see, how do I need to stop sharing. And I think we are back. And so I would now like to open it up to the floor to who would like to open the discussion on what are your standards for equity.
Hey, Bob, this is Teresa,
Yes, ma'am.
and I'm going to cut on my video, but you can see I'm in my workout clothes. That's why I had it off.
Okay.
So I will cut it off as soon as I finish speaking. But I'm excited to answer the question because, like you, when I was facilitating yesterday, I try not to lead the discussion. But to me, equity is simply understanding that it's not equality. Equality simply, they're just such different words. And if we just understood that in a perfect world, if we were all equal, but the reality is that's not the case. And that's where equity comes in. not treating people equally. So with that, I'm going to disappear.
Thank you, Teresa. And was checking, it looked like there's a little bit of chat going on. Who would like to go next? Ethan.
Hi, good morning. I would say that in the context of health, I think it's the ability for everyone in our community to attain the highest level of health possible, regardless of their income, their race, or any other circumstances.
Outstanding. Thank you for sharing that. Hey, Robin, go ahead.
So I continue to explore this because I think I land on one thing and then I read something else or I hear something else. And this is going to be a lifelong process for me to continue to learn. But really for me, what equity is, because we're all about customer choice, that someone gets to choose where they go to school, they get to choose what they want to do for a living. And I want to make sure everyone has access to those same choices, that they understand that they have all those opportunities and then they all have the potential to act on those. And some need more assistance, going back to the mayor's visual of the boxes. Some need more boxes maybe to get to that choice. But my concern is that there's so many they don't even think that that's even an option. And so we don't make good decisions if we don't realize all the options that are available to us. And so for me, that's what equity is, and where our space is going to be, or our role in that space will be, is making sure that everyone knows they have the choice.
Thank you for sharing that, Robin. And I think we did talk a lot about creating more awareness. Ms. Ramos.
Yes, I would love to piggyback on what Robin said because she brought up a very valid point. For myself, when I went to college for the first time, I was not aware of what I was getting to as far as student loan issues, and which has created tons of debt for me. So that is an important issue that I think it is valid to bring up about student loan, because then we create a place where now you have bad credit, and then going into buying a home becomes an issue. So it's a trickle down effect that creates a lifelong of issues for a person when they are not aware of the opportunities that they have.
Excellent. Thank you. Excellent. Thanks for sharing that. And I seem to have for a second, but who else would like to share? Eileen?
Yes, equity to me right now in the forefront of my mind is that everyone has the basic right to receive the same health care as everyone else. And whether that be transportation to a hospital, or whether that is vaccinations, or a choice of what kind of a facility they need to go to, or doctor they need to have. And they don't need to put off care because they can't afford it. So right now, that's what I'm thinking about.
Thank you. Else who would like, is there anyone, there are some people who dial in but don't have video, and just you can either
I'll go ahead and weigh in just a little bit. For me, it's a word that while it has a definition, I have a hard time since I've become a mayor of not using language that forces action on my part. So I refer to equity as an effort to both expose and eliminate barriers. And I realize it's much broader than that, but for me, if in the context of my role, that's the way that I confront and look at equity. So when I see the word or when I see the condition or someone's experience, doesn't matter, you know, what their socioeconomic status may be, their race or ethnicity, it cuts across every imaginable demographic. But for me, I have to work on first exposing it so that I'm not the only one that sees it. Because I realize that I'm not the only one that, you know, I don't have the power to do much about it. But I know that collectively we do. And then finally, you know, at the end of the day, I want to put measures in place that will eliminate it. So that's my perspective.
Thank you very much, Mayor. And I apologize in advance for the team. Even though I have this amazing 300 megabit Spectrum internet connection, for some reason today it's decided to be a little flaky. So I was panicking in the middle of that. I actually lost connection, but fortunately it came back. You may get a text from me, Mayor. I was panicking. So you may have to take back over if this continues. But who else would like to share?
This is Karen Delisle. And Our Lady of Lourdes, we did a class, Waking Up White, and we had Maria Long come in as a speaker, and she pointed out the health disparities between Black young moms and Black children. And the statistic was that Black infants have a 50% more chance of dying before their first birthday. So I think that was shocking, and I don't know that that information is widely disseminated. And I would, you know, absolutely point to that. And food nutrition, being a retired nurse, I think I think there is a right to health care. And so I'm firmly behind that. Thank you.
Thank you for sharing that. And I was hoping that Dr. Wathington would be on with us today. But Ethan, from your perspective at the health department, I hate to put you on the spot, but I mean, can you share anything that you've seen from your vantage point in terms of health disparities in our community?
Sure. Well, for starters, actually, the infant mortality is one of the ones. So in public health, we know infant mortality is the key indicator of a community's health across the world. That's what people look at first. So if we're looking at infant mortality specifically, and we do see that in Volusia County, it's not just, we see it everywhere, but we also see it in Volusia County. We know that that's kind of amazing to see something like that. But we also, it's hard to have this conversation without having the same conversation about racial injustices and historical implications, because we also know that it's a large body of research out there. I don't know if anyone's ever heard of Unnatural Causes or When the Bow Breaks. That's probably about 10 or 12 years old now. But one of the segments on there, they're discussing that, and they're looking at infant mortality and the differences between Black and white infants. And they control for things like education and access to finances and things like that. And what they found was that people with higher levels of education, even a Black woman, she was and this was the case that was in the video on Natural Causes, but she was a Black woman, a lawyer, she was high income, and yet her birth outcomes were still than a white woman with a high school diploma. So there's all sorts of implications as it relates to stress specific to racism and how that impacts a woman's body, as well as, I know last time we talked a little bit about breastfeeding, and we see that at the health department as well, how, you know, Black women breastfeed at a lower rate. We know that that impacts the rate of infant mortality, and we know that that has historical implications. So I think one of the big things is that recognizing that even if we control in the spirit of equity, even if we address the income disparities, even if we address the issues related to education, there's still, if we're not able to address those issues that surround race, that would be a problem. And then in terms of the health department specifically, most recently, one of the things we did, which at this point now was probably about 1.5 years ago, the Bay Area Regional Health Inequities Initiative. We had this grant to do this organizational self-assessment, and I can share it with the group if you are interested. It's specific to county health departments. This is actually out of a county in California that created it, but it's the organizational self-assessment that addresses your organization's capacity to address health inequities. This wasn't anything we did to publish, we did it for ourselves. But what we found was surprising to our leaders here and to staff, because, here we are saying, we want to address these inequities, we want to see these things, but then when we look at pay, when we look at communication, when we look at access to information within our own organization, we see inequities. And although that may not be tied to race or income, it still speaks to our inability maybe to address some other external issues. So I think that's another thing that we've recognized too, is that internal self-assessments within our organizations are really important. And I know there are a lot of different tools out there that are specific to everyone's areas, but I mean, it's, for me personally, it was shocking to know, gosh, we're sitting here saying we want to be equity champions. And we're like, well, these are issues with equity right in our own walls that we aren't addressing.
Thank you for sharing that, Ethan. That's excellent. And I mean, to your point, several points. One of the resources that was brought up in yesterday's session was a book by Dr. Ibram Kendi. And so I did some research on that, and he talks about the focus on outcomes, and that, while you might be doing the same things, if you're getting different outcomes, then we need to dig deeper and try to understand, why do those disparities still exist? And so those were some fascinating things you shared with us. Thank you, Ethan. We have had a few other people join us. We started the session reviewing a little bit what we learned in the listening sessions last time, and then we asked everyone if they would share, for yourself, what is your standard? What are your standards for equity? And so is there anyone else who would like to weigh in on that, who might have joined us a little late? Robin, did you want to speak?
Well, I just wanted to follow up on what Ethan said. Now, I had found, because that's one of the first things I want us to do as an organization, is to do a self-assessment. And I found one done that's available from the Portland State University, Cultural Competence. But if you have any other self-assessments that an agency can use to really take a look at its services and how we deliver those services and do outreach and all those kinds of things, if you wouldn't mind sharing that either in the chat, or because Teresa taught us yesterday something I didn't know, that when you bring up the chat, that the 3 little dots in there, that you can save a chat. Boy, was that a handy thing to learn yesterday. So thank you, Teresa. We all need to share those little tricks as we're learning all these new platforms. But Ethan, if you've got any other examples that we could use, I would really appreciate that.
Sure, I'll share what I can find, definitely.
Okay, thank you.
Ms. Turner.
Thank you. Ethan, I just had a question for you. I mean, you speak very well, but one thing that stuck with me, what are inequities to access information? How could that be?
So when I said that, I was actually speaking specifically to like our internal processes. So a good example of that would be COVID-19 response. And what's going on. So we have a management level response, and we understand what's happening, and we've directed, things that are going on, but we also have staff members who aren't necessarily involved in that response effort at all. So then what does that mean in terms of how they feel connected to the organization? And then what does that mean in terms of how they're able to respond to customers or clients? So it's not in the traditional sense when we consider health equity like a disparity. But when we look at something like communication or information, if at the top we're deciding that this is what it means to address health equity, this is what it means, this is how we address this in our frontline service provision. But then the people at the bottom aren't given that message, they never receive it, then one, they have a personal feelings of being disconnected from the organization, but two, they also don't understand what it's supposed to be, how it's supposed to be communicated. So there's that disconnect, which then causes health inequities between our clients because that information isn't being shared with them on the front line.
Thank you. Much clearer. Thanks.
So,
Very well said.
I'm Mary Ann
Yes, ma'am.
from Our Lady of Lourdes, and appreciate all the comments. My learning curve is still learning there. With my past experiences as a psychiatric nurse, but saw that there was, as Ethan had pointed out, this disconnection when the patient would come to the hospital, we do treatment, and then leave. It felt like a lot of times there was not a seamless transition for the client who could not access resources themselves, didn't have the mental, emotional, monetary capacity to wade through the myriad of possible resources. So I see that as for me, as part of the equity basis, is that the networking, that the client can go to someone, that someone is going to help them through this network, at least to the same person. I was on a faith meeting, I think it was yesterday, and it became apparent that two entities, the Volusia County Sheriff Department and the DJJ Department of Juvenile Justice, weren't on the same page as far as transferring of information. Things were getting missed, things were not only missed, but just and the end result of some of the clients were not getting properly treated or in process through the system. So that to me is part of the equity when I don't know how these organizations, government organizations or resource or community organizations need to come together so that happens. That's part of the equity for me. Thank you.
Thank you for sharing that. And, we really haven't focused too much on behavioral health and, how that relates to everything. You reminded me that I attended a session a while back on community health centers, and it was interesting, well, first of all, and I'm sure Ethan can verify this too. I mean, we have a shortage of behavioral health professionals in our community, and it's actually kind of a national problem. But another part of it, just in terms of that, is sort of the stigma that seems to be associated with pursuing behavioral health, whether it's counseling or psychiatric care. And it was interesting, this one, actually it was a statewide network of community health centers where they had done, over the course of the year, they'd done an initiative on diabetes statewide, and it was successful. I think, they were able to measure that they had reduced diabetes by 6 or 7% over the course of the year. They felt good about that. And then the next year, they decided to focus on behavioral health, and they actually embedded licensed clinical social workers in each of the primary care centers, where when people would come in for their regular annual physical or for some other issue that they might have, or whether it's being treated for chronic disease or whatever, the primary care physician had learned to do a little bit of screening and would then, if it looked like a behavioral health consult was warranted, rather than writing out a referral script, they would walk the person down the hall and introduce them to the counselor. And so they found that whereas previously the follow-up on referrals was running like 25 or 30%. You know, people would get a referral and 3/4 of them wouldn't follow up. But now with this personal handoff and connection, they were starting to see 60 and 70% follow through. But the most amazing thing was that as people started getting the behavioral health counseling that they needed, that they actually measured twice the improvement in the reduction in diabetes. Because it turns out so many of the people who had diabetes, it was due to overeating and compulsive eating and a poor lifestyle that was related to mental health, behavioral health. So anyway, thank you very much, Marianne, for bringing that up. And that's, you know, probably something that we'll want to, you know, keep in mind. Who else would like to share? And Teresa, you only need to mute because we're hearing your background noise. Thank you. Anyone else?
Comment on that.
Yes, ma'am, Lucretia.
Thank you so much for sharing about what you were referring to with mental health and the health of our mental state, because as a child of 8, both of my parents, I had both parents in my home. They were pastors. They both worked very hard. My mom worked 3 jobs at times to provide for us. There were times that we had no food in the home. There were times even with food stamps, you know, we made a way to survive. And what you're saying about being able to have the education of what to eat, how to eat, was not there. You know, sometimes we were definitely eating tons of pork, tons of sugar, you know. So it's important to understand now that I'm able to provide for my family. We understand now eating healthy costs the exact same as eating unhealthy. We didn't realize that growing up. We thought that, you know, we could only afford hot dogs or beans or rice, you know, things like that. But in the same essence, lettuce, apples, and oranges cost about the same price. So understanding where we are as a nation when it comes to giving people the resources that they need is very important, because so many people are out there saying, well, I can't afford to eat healthy. Eating healthy is too expensive. But that's the way they were raised. And so that's how they were taught. It's not that they're going into the market and actually seeing, wait a minute, it actually costs the same. They go to the exact same grocery store week after week after week, or the fast food restaurant when you can choose, you know, Chick-fil-A over Burger King, or you can choose, you know, it's about making healthier choices. And like you said, that's a mental health issue. And I think that's important to start very early on, like in our school systems. It's important to introduce our children that very early on. And then as they age, it just becomes a way of life. And so that's what I wanted to share.
Thank you for sharing that. Well, why don't we segue into beginning to get to the next phase towards what Mayor Henry has set out for us in terms of, you know, how can we facilitate and improve equity? And again, I thought Teresa had a great idea on how to kick this off. And so she challenged the group with what is a change that you can make personally in your sphere of influence to facilitate and improve equity. So I'll put that question out there, you know, and hopefully some of you have given that some thought in preparation for this focus group. So is there anyone who would like to share any thoughts that they might have on that point? Yes, ma'am, Lucretia.
I wanted to give anyone else the opportunity to speak first. But ways that I have chosen to improve equity, not only in the community, but first it started in my home. Like we've been talking about first, you know, charity starts at home, love starts at home. Everything that we need to build this community, even as a nation, has to start in our homes. what we're teaching our children, what we're teaching our families, and then it will spread into the communities. So the value that we put on equity is the same value that the community is going to put on it. And so I believe that's what we're starting now. The fact that we're creating this forum is giving humongous value on equity, because the word equality is just not the same anymore. People see that as just a stereotype or a very cliche word, and it becomes a word that is shunned. So I love the fact that we're using the word equity. But I believe, again, it starts at home, and in ways that I have chosen. My children are allowed to shop with me or choose items when we're shopping. When I go out into the community, helping, the homeless in the community, there's many in the community, and just showing them different options. It's not always about just giving money to the homeless. It's also about talking to them and knowing that they have options. I've talked with plenty of them, prayed with plenty of them, and just kind of counseled with some of them. So it's not always to point a finger or convict or to blame, when we in essence can help rehabilitate, sorry about that, in the process. But that's what I want to share.
Thank you so much. Sue?
One of the issues, every family has different levels in their family, so to speak. I come from a very large family where there are people that have lots of opportunities and where there are people that are living a different lifestyle. And one of the things is to try and break that cycle of you don't have a choice. This is your life. This is all you can be. And to break that cycle and encourage the new generation to move beyond it. It's difficult. It really is difficult to work with in that framework that your mom or your grandma is a nice person, or they are your mom. Maybe they're not a nice person, but this is your life and you have a choice as to how it moves forward.
Would you elaborate a little more on, how do you create awareness in a person on, the spectrum of choices and what's going to have a better outcome than maybe something that they were brought up with?
Well, there's the value of education. There's what you choose to eat. There's whether or not you choose to try to get a better job, try to, live a better lifestyle, or whether you continue to look for the handouts, whether you continue to, some of them don't know that that food is bad for them. Some of them don't accept that that food is bad for them. I have a niece that she's been between different families, bounced around. Now that child weighs 300 pounds and is going to have a bypass surgery at 23. It just boggles my mind. And yet she has accepted that lifestyle is her lifestyle. I quite honestly don't know what to do, what to say. It just is very upsetting.
Thank you for sharing that. Robin, did you want to make a comment?
Yes, please. So, for me, I've got some very personal things I need to continue to learn. I had never considered myself to have white privilege. I did not come from a very healthy environment, let's put it that way. So I've had a straight up learning curve, and accepting that, yes, the color of my skin gave me privilege. my youth gave me privilege. And even just the mentors I had access to when I was in foster care and other things gave me privilege. So there's that. And I'm grateful that there's a lot of honest opinions, and that might not be the right way to say it, but there's some really good information out there that we can all learn from. But I want to talk a little bit about the activity that we decided on yesterday at the Business and Media. And it's not necessarily a big move in equity, but it's going to help start that foundation. You know, so I can go and help clean a park. I can help organize cleaning a park and get to know others that are on these groups, because we will be inviting everyone from all of the 5 focus groups to participate. This idea came from one of the businesses that was on the call yesterday. And this was what he wanted to do as a way of giving back. I don't know, is it 30? I can't remember what Trey's company's name is.
The 30s.
The 30s. But he and I are going to meet tomorrow morning, kind of do an inventory and assess what the need would be, and then spend a couple hours on a Sunday morning. Mark your calendar, August 2nd at 8 o'clock is when we get together at the Samuel Butts Park on Bellevue. And just starting to build community among those of us who want to have this change so that we can work forward together. The mayor's going to be there too, right?
That's correct. Jenny would like to speak, but that is correct. I will be there. And I would like to see more of those things, but it's an organic process, and that was organic. It just happened. And more can happen in our community.
And I did reach out to Reed. And just so you know, your staff, he's on vacation in Upper Michigan, and he called me as soon as he got the email. So you need to tell your staff to unplug better. Just saying.
Thank you, Mayor Henry, and thank you, everyone. I'm Jenny Nazak with the Daytona Beach Permaculture Guild, and I'm very focused on ensuring, because there's a strong connection between a healthy environment ecologically and the physical and mental health of humans. So I'm very passionate about having fresh food growing in urban environments, and having plenty of shade trees in urban environments. And then also having swimmable waterways for everyone to have access to swimmable waterways. I really loved what was mentioned about how improving people's mental health improve their physical outcomes. And so the physical environment definitely has a bearing on that. We have a lot that we can do to improve the safety and walkability of neighborhoods by street trees, for example, adding shade. Some places you walk around, you don't want to walk there because there's no shade. And so who's going to get out and walk and exercise? And then the thing about the food, we actually have a lot of land. Even within a developed urban area, we have a great deal of land that can potentially be utilized to grow fresh food of all kinds. So I'm always very interested in these conversations, and I appreciate this whole initiative. Thank you, everybody.
Thank you, Jenny, for sharing that. Ethan.
Yeah, I'm thinking, and this isn't a terminology we already use. It just kind of thought of it. Maybe it exists somewhere, but like equity ears, like having equity ears, because I'm thinking we don't have a name for it, but what we've been trying to do at DOH over the past couple of years is like train our staff to really be able to listen to what a client or what someone we encounter, what their needs actually are. Like they may be there for a WIC visit, and if you're a WIC counselor and you're doing the questionnaire and you're asking them about what they drink, and their kid is like, oh, I drink Kool-Aid, every day. And we have a dental clinic that WIC client probably qualifies for. Why wouldn't we immediately then schedule them an appointment in our dental clinic? What historically, I guess, before the last couple of years happened, to be like, oh, wow, yeah, you really shouldn't be drinking Kool-Aid, and we continue going. And I guess I call it equity years because all of us probably encounter like residents, people in our neighborhood, clients, and we have this opportunity to engage them, but we miss out on it because we're like so one-track focused. It's like, no, this is my job. This is my specialty. I know that you had problems with transportation getting here, but that's not really my problem right now, when really we should be tailoring the services to be more holistic. I may not be able to, give you a teeth cleaning, but I know the hygienist that can. So what we've done here is we have hygienists now that are actually in our WIC clinic. We try to cross-train as many staff people as possible so that they're able to respond that way. And then I know there's a larger community effort for us to be better prepared for referrals. I know in a DOH Miami-Dade, it was interesting, in their restrooms that are in their clinic, they have like, I guess where you would put like some type of blood or urine sample, they have a little number that it says, use the green cap if you're here against your will, or something like that, something along the lines to address the human trafficking issue. So they just put the urine with a different top on it, and the nurse immediately knows to address that person, in a different way, to move them away from the person they came in with. And I think so when we're talking about health equity, it really requires us to think outside of whatever our purpose is, our service is. And then the last thing I'll say, because I think Lucretia and Robin brought it up, I think for us to be able to do that, we have to build relationships and we have to recognize our own privilege, or we can't meet there in the middle. Relationships, because people need to trust you, and then privilege, all of us have some type of element that we're not willing to do. And I do health equity trainings and things like that with our staff all the time. And I'm one of maybe 3 Black men under the age of 35 that work here out of our 270 employees. So me talking to a room full of middle-aged white people about health equity or racism, it's not going to come off well. But when I lead with, first of all, I recognize I have my own level of privilege being I have my own level of privilege having 2 college-educated parents. So I think it's important for us to recognize that before we can help other people. And that's it.
Very well said, Ethan. Thank you for sharing that. Other thoughts? To Ethan's point, I will share. A while back, I was at the health department for I think it was a health disparities conference co-sponsored by Bethune-Cookman University. And we had a guest speaker, a very successful African-American surgeon from Moffitt Oncology Center over in Tampa. And he had been, they were doing some diversity training for the physicians. And so he was speaking in front of a room full of physicians. And he said you could tell by the body language that there were a number of senior white physicians that kind of resented having to spend time there and being there. And finally, one of them just got so frustrated, he stood up and with anger on his face, he said, I can't stand this. This makes no sense to me. Why you feel like I need this. I have always, and I take great pride throughout my practice, that I treat everyone the same. And the African-American surgeon said, thank you, that's my point. You can't treat everyone the same. They won't end up with the same, they won't hear you the same way. They won't perceive you the same way. They don't have the same needs. And so exactly how we see that we needed to restack the boxes looking over the fence in the mayor's beautiful graphic there. Each individual has different needs. And in the health arena, people can't all be treated the same, or we're definitely not going to get the same outcomes.
Bob, hi, Bob. Can you hear me?
Yes.
Okay, I apologize for not being on mute earlier. I'm multitasking this morning. But I want to just a little bit of a response to Ethan. I personally believe, and I know many of you know Dr. Primrose Cameron, who's leading the education forum. that more white people need to be involved in the diversity and equity training, for a variety of reasons that, everybody probably has their own opinion, but when we're not really sure how to say what I want to say, but Primrose and I believe that when we train together, it's a bigger impact than just her as a Black woman or just me as a white woman, because we can play off each other. And I think as white people, we have to realize that we are a large part of where the change needs to happen. So why it doesn't make sense that we think only Black people should be the diversity, equity, and inclusion trainers. So Ethan, I appreciate what you said, and just think there's more of us white people that need to take some ownership in helping make that change.
And I do have a quick response to that.
Okay.
I 100% agree. But I think what's really important, probably more so than the face of the person doing the training, is how the content. So we did have, as a part of that organizational assessment and the grant we had for it, we had people from Human Impact Partners, which is also based out of California. And they came and they did one of those, a huge diversity inclusion, really the best thing I've ever seen. It was really great. It was 2 days long. We had to do staff schedule, and they go all over the country and do this with different organizations. And I have to say that it was received pretty bad by our staff. They were being called racist. They felt like they were being this. All three presenters presented as white people, though. One was the other person was Middle Eastern, and the other one was a redhead white guy from Boston. And he was the one that was going the hardest when it came to, because their model is they believe health equity is strictly tied to systemic racism. And everything else is, after that. And that's their model that they preach. And they were white, but it wasn't received well. And I think our problem that time, and we consulted with them before because they hadn't done any of these trainings in the Southeastern United States. And we told them, we were like, well, we agree with everything you're doing, but we knew that it probably wasn't going to be
go well.
Delivery method. So I think that's important as well, regardless of, what we look like, how we're communicating this message, especially here.
Absolutely. Absolutely.
Lucretia?
Yeah, great topics. Because I see, unfortunately, we're maybe losing some people in the conversation. Hopefully not, because I want you to stay open-minded about this, because we don't want to make it about race. We do want to make it about education across the board, because everybody deserves, then that's why we're using the word now, equity. It is important. Like we chose, when we moved from Texas to Florida, Texas, of course, you guys know, very, I'll leave that alone. You know what Texas is. I love Texas, born and raised there. My family is there. Bless their hearts. We chose to move to Florida for a very specific reason. And then on behalf of that, we chose to move to the area of Daytona that we are. We're in the heart of the Martin Luther King area. And I want to eventually buy land here because I believe that certain people can go to certain areas and make a change. But when you go to areas like where I am using big words, equity, you have to relate to the people in the area. You guys understand what I'm saying? And I believe that in order to ensure change, just like Teresa was saying, absolutely, it's great to come together as a community. But if Teresa came to this neighborhood and began to speaking or knocking on doors in the neighborhood, she may not get the same response as I would in the neighborhood. But if we go collectively as the group, they'll see, wait a minute, it may turn some heads. So it's very important to do this together. So I love that idea. And Ethan, when you talked about having that way out for those people with the green top, how powerful was that? I got goosebumps thinking about that. I was in an abusive relationship before, and me standing there with a smile on my face, wishing people could see my pain. that would have been humongous, you know, an opportunity to do something special. That's what you guys are providing a way out for that. So I love that idea. And I think that should be also provided in the schools. I have seen so many times in the schools where children are being bullied and they have no way out because they feel like if they talk, they can't come back tomorrow. And it's just, it's painful to see. You know, I worked in the Boys and Girls Club. That's my life history anyway. But again, both of my parents, neither one of them graduated high school. Neither one of them. All 8 of us children graduated high school. Not all of us went to college. So we all have different, like Bob was saying, everybody had to make their choice, what you want to do with your life. And Suzanne even mentioned it. We had to make a choice. Some went to jail. You know, we made different decisions. But education, I felt, was the main thing that got me off of welfare. It got me out of wanting to live a poverty life because I didn't know I was living in a poverty situation. I didn't realize the road that I was on. You know, sometimes, like you said, and I know everybody is repeating the same thing if you really think about it. Overall health and well-being is so important, but you have to know that you have a problem. We're not taught that we have a problem. You know, being on food stamps is a problem, but people don't know it is. You know, living on welfare for all of your life is a problem, but you don't realize it is. Being on government assistance all of your life is a problem, but people don't know that it is because they're like, I'm used to this. I'm used to this lifestyle. So this can become permanent for me. And then I teach my children that lifestyle and they teach their children that lifestyle. So education is fundamental. I don't want to take up more of your time. Thank you.
Thank you very much, Lucretia. Robin.
So to add to that a little bit, taking this with the lens of human-centered design, you know, that we're not going in to fix what's broken. We're not going to go into the neighborhoods and say, we're here to help. You know, that and again, it kind of goes back to the activity when Dre's brought that up yesterday. This is my community too. I live in 32114. This is a park I use. And so it's not going in and saying, you know, especially if you're government funded, you know, with the government, we're here to help. That never goes over well. But it's building that community with the residents as well. Because we can go in and say, okay, here are all your choices. But if they don't know who I am or who we are or what we do, then they have no use for that. Because you're right, that the generational kind of mentality of this works, this is my life. And there are some, I mean, back in the day when I was a case manager, I can remember working with a young gal. She had just found out she was pregnant with number 3 and she was lost. She wanted better for her children. And so we really crafted what she wanted to do and kind of came up with a step-by-step plan. And she was psyched when she left my office. Next time I saw her, a month later, she hadn't done any of it. And I asked why. And she went home, she was excited. She told her mom, and her mom said, so you can be better than the rest of us?
Yeah.
And I didn't realize there were parents out there who have that mentality. So I'm just, that it's going to be small steps is what I'm saying in how we introduce this into our communities. And I mean not other communities, but it's going back to what Bob said and Teresa and the mayor, our sphere of influence, where we can have some momentum and then let that build and kind of trickle out.
Thank you for sharing that, Robin. Randolyn, did you want to speak?
Hi, good morning still, everyone. I just want to echo a little bit more about what's been being shared. And I think that at times it's a little bit of a understanding what the community needs. We're here and we're speaking to what we know, but do we really have the public knowledge of what what our community, what our city of Daytona Beach needs? And so it's really thinking about, my perspective is asking the right questions. You know, so it's asking questions like, had to happen. So it's asking questions like, what kind of community do they want? What are the 2 or 3 most important issues that the community sees as problems? Why is that a concern? How are these issues affecting them personally? And, I have a list of 10 questions that, that are helpful to ask the community. So getting out into the churches, into the community centers, being a shared force, as Lucretia and Teresa shared, I have a passion for this. I want to go out and say, hey, let's have these conversations. But as a white woman who is, just out there and saying, hey, let's have these conversations, we need to have that shared force and that shared vision to really see what it is that is affecting our community, what they see as affecting themselves, so that we can really start to address those equity needs.
Well, thank you for sharing that, but I'd like you to elaborate a little more, because I think you were, touching on being very specific of action that you think you could take or would like to take. Could you elaborate on that a little bit?
Yeah, so the action that where I see value, especially as a United Way employee and being a United Way ambassador, is to have what is called community conversations. And those community conversations are held in small groups, similar to these, to like our work group, but of 10 to 12 people who are community residents, and asking those questions, those 10 questions that are guided. And it's really about listening to the needs, taking those needs back, and then working to address what those needs are. So not a focus group, but an actual conversation. It's like a kitchen table kind of conversation. And that is something that I see would be valuable. I think that these focus groups that we're having over Zoom are very helpful. They're great. Not everyone has access to technology to be able to participate in all these. So, having these small groups that we're able to maybe socially distance, or having them outside. I know it's hot. My AC is broken, getting repaired right now. It is hot. So it is, I think that there's ways that we could do it and still be within the guidelines of trying to stay safe. And that's where I would like to see our combined efforts move.
Outstanding. I love that idea. Others have thoughts about that. Ethan.
Hey, Randallin, I would definitely say that that DOH would want to support that, and we would want to be a part of that however we could. And then I also would say that before we would engage in those type of conversations, we'd want to definitely look at some of that type of data that we've gathered within recent times. So I know that just this past year, we did the community health needs assessment, and Halifax was involved in that, Advent Health, you guys at United Way. It was a community effort. And I think we did about 3 or 4 focus groups in the Daytona Beach area. And then in addition to that, we obviously did the major assessment where we got quite a bit of data. So I think it does always help when we go to expand conversations, or to, have conversations, that we do reference things that we've already gained, so that they understand it's like, we're hearing what you say, we want you to elaborate. But I'd be happy to, help kind of compile some of that as we like inform that or whatever.
That would be fantastic.
Lucretia, I see you nodding there. Did you have any additional thoughts on that?
I was just trying to subliminally let Ronald know that I was agreeing and absolutely wanted to team up with her in any way that I can to assist in that. I think that's a great idea. Let's all do this together. Some way, somehow, we can make the community know that we're here to work to make this thing a better place.
Well, I'm the kind of guy that really, once you give an idea, and city staff will tell you, I don't really wait very long once I decide to do something. So just like yesterday session when they decided to pick up trash, I was like, well, why would we wait to pick a date? You know, you know, because the energy's here now. So Randall, what exactly are you thinking we would get out of these sessions? And let's just go a little deeper into what your thoughts are of what they would look like, how we would arrange them, that sort of thing.
I think the overarching, you know, what are we going to get out of it is a more engaged community, so that they're not seeing us come in and say, hey, we're here to fix you. It's here, like Ethan kind of said, is here, we're listening to you. We're here to kind of assess what you think the needs are in your community, and then we can come back and form groups or work groups, or come up with ideas and ways that we can really help the community. I see this as getting churches involved. Like I said, a lot of the local churches and community centers, getting them involved where they have access to the community members, and having small groups, 10 to 12 people, that is being co-facilitated to ask these questions. The 10 questions are, what kind of community do you want? Given what we just said, what are the 2 to 3 most important issues, concerns when it comes to the community? What concerns do you have about this issue and why? How do the issues we're talking about affect you personally? When you think about these things, how do you feel about what's going on? What do you think is keeping us from making the progress we want? When you think about what we've talked about, what are the kinds of things that could be done to make a difference? Thinking back over the conversation, what groups or individuals would you trust to take action on these things? If we came back together in 6 months or a year, what might you expect as an indicator to the things we talked about tonight are going to start to happen? And now that we've talked about this issue, what questions do you have? So these questions are formulated from the Harwood Institute. I recently went to a public innovators training, a 10-week training with the Harwood Institute to learn how to facilitate these community conversations, to be able to not necessarily share what my opinion is, but to really just facilitate and let the community drive these conversations. And I feel that it would be valuable to hear directly from the members of the communities that we're trying to affect change in.
So Randall, there's no question about what they consider is working well that we could build on, which I find kind of lacking in that structure. It's just assuming there's things that are wrong that need to be fixed, as opposed there's positives that we could build on.
Mm-hmm.
So,
and I think that could come out of the conversation, and that could be a question that could be added. I think that these are base questions, but asking something like what is working would be a great piece to add to that.
I mean, even, you know, like with us, I do a internal staff survey every 6 months of all the staff. And for years, I would ask, what's wrong? What do we need to fix? And one day I asked, what am I not asking? And they said, you don't ask us what's working.
Oh.
So now we ask. And there's a facilitator out of Texas who really talks about, she doesn't do SWATs, she does soaring as in flying. But really talking about, we're not going into communities to fix them. Mm-hmm. Nobody wants that. Nobody wants to be told they're broken. It's really about, what do you got that we can build and help you build on?
Yeah, that's great. And that's a great suggestion. I think that would be really helpful.
You know,
I also want to give a little feedback as it relates to how you would, because engagement is it's hard. Mm-hmm. It's really just hard. It's hard to get people to engage. people really do have opinions, but they only share them typically in their little enclaves.
Mhm.
They don't typically venture outside of those. Even as an elected person, I've knocked on probably 20,000 doors. And the only way for me really to get engagement from voters is for me to knock on a door with my survey and ask questions and talk to voters. I can, if I mail them a survey, if I call them on the phone, they're much less likely to participate. If I go to their church, they're just not going to give me that feedback until I literally knock on their door with my mayor's shirt on or my hat on that says re-elect me before I was mayor. And churches, by and large now, don't have the same influence over the population, perhaps that we're referring to, that disenfranchised population is less likely to engage because they are having a hard time, making this transition to the new world and bringing that generation into their worship experiences. So while I do realize you would have to engage the churches, we have to think of other mechanisms to really get that population. And I'm thinking the population of 18 to 40.
So
Mhm.
to kind of go on that, Mayor Henry, if we have people walking through our doors, whether that's the Early Learning Coalition or Career Source or United Way or the health department, and we were trained to be facilitators, but just on that one-on-one might be a way to start, because they're already coming to us. We already have a relationship with them. So we're not going into their community necessarily or going into the church. I mean, it might be just a foundation where several of us know how to have that one-on-one conversation, because I think that's what you're really talking about, Mayor, that it's, and by the way, you have not been to my house yet. I keep waiting. It's the only time the mayor ever comes to my house. And we get to sit on the front step and solve all the world problems in 5 minutes. But it's just a suggestion, Randolyn, that, finding community champions who want to gather this information. So it's not necessarily a survey, because we survey our community to death. But if Ethan at the health department, and I'm not talking even like I wouldn't be the one, but their case, my case managers, the people who are actually working with them, saying, hey, we're really looking at some things. Would you give me 5 minutes or 10 minutes and let the conversation to be organic? Is just a thought of maybe collecting some of that, because once the word starts getting out, those same questions are being asked. Then when we do go into the churches, maybe, or we go and oh yeah, I heard that, because we need to find the champions that also help talk this up in the communities.
I would like to.
Lucretia, then we'll go to Karen.
Thank you, Bob. I would like to offer a suggestion, because like the mayor said, this is unfortunately a new situation that we are embarking on, and we want to reach that demographic of 18 to 40-year-olds. And where are they? They are currently where we all are now. They're on social media. They're on the internet. And Mayor, that's how I found you. On Facebook, and I was intrigued by some of your comments on Facebook, and so that's what gained my interest. And we have to come to them where they are, and they're on social media. Now, here's the thing. Social media brings an audience of billions of people a day across the world. So if you can't knock on their doors, if you're not getting enough traffic at the church, then maybe we should invest in a marketing presence where people who are very intuitive on this social media thing know how to bring in an audience, know how to market your social media, and are very well versed in social media. I think that would be a great outlet to reach people 24 hours a day, definitely of that demographic. College children, business people, they're all looking for the exact same thing that you are, and that's foot traffic. And where do they go to do that? Social media, because that is the #1 source these days to make sure you find the numbers. So again, to me, that would be a great way to market. Of course, I would love to be a part of any forum or community, but honestly, in order to bring them, you're going to have to find them where they are.
Thank you, Lucretia. Karen?
I just wanted to share that in the faith organization, each year in the fall, we have house meetings where people come together, maybe 8 to 10 to 12 people. And the question I ask, and these are people you see at church and you think you know them, and they come in, and in a small group start sharing. And the question I usually ask is, what keeps you awake at night? What is the one change you want to see in the community? And then they give you that input. And I think I agree with the social media, with the young people. That's absolutely the way to go. But if you could do a Zoom meeting like this too, and I think it's just really listening and not being judgmental, not leading too much. You really get a lot of input and you think, wow, I've sat next to them for 2 years and I never knew they had a daughter that was killed in a domestic violence incident or things like that. And so we have found it to be quite successful. We then go on and vote on which ones to pursue. But it's a good information gathering process. And I would be glad to help with that also.
Thank you, Karen. Ethan?
Another suggestion, again, in the spirit of meeting people where they are and actually getting that demographic we're looking for, if Daytona Beach sports and athletics, if those pick up in the fall, you have a group of parents there. So if we're able to tag on to that, you've got that. And then also, and I'm not sure what the exact terminology is, you may know, Randall, but they're almost like pop-up discussions. So it's like, at the playground, right there in the middle of a housing complex or something like that. We're just there for 3 hours. And as parents come by or whatever, we ask them if they have a moment. I mean, that's a little like, cold called in, but like, sometimes it works if people have the time and their kids are playing. They won't mind having a conversation.
That's a great idea.
Other thoughts?
Sit down and have a cup of coffee. Offer a bottle of water or a glass of something. People will talk with you then.
So I'm hearing several different strategies for engagement. Robin hit on something, but I really think it was where Ethan was headed early on when he talked about equity ears. Listening. I mean, if you're in a situation where you have broad community engagement, then let's have those people become sensitized and create awareness and be listening for an opportunity to engage someone. And then to the mayor's point, to whatever extent you can get that one-on-one engagement at that juncture. But then the other thing is, what are the other places that we can engage people who otherwise are somewhat disenfranchised, given that, I know my church has been dwindling in membership for years, and I think that's a nationwide issue. And so, Lucretia brings up an awesome point about, social media is the thing today. And so I don't know, I think there's one thought I had is, can you use a social media platform as sort of an engagement, but then, and kind of like it worked today with you, Lucretia, I mean, you learned about what the initiative, but then you came together in this smaller group and have been an awesome participant, and we've all gotten to benefit from the conversation that we're having today. So maybe, there is some one-on-one, whether it's, going to the athletic events or having those pop-up discussions in those places, but then maybe there's another strategy that you use those opportunities to find someone who's willing to then have that kitchen table discussion or, coffee clutch, if you will, and go through those 10 questions that, and maybe in a facilitated way that Randall suggested, and maybe dig a little deeper. I mean, I think those are all great suggestions.
I want to be clear, guys. I'm not suggesting that you not do small groups at all, because I've realized that there's an energy around a small group. I'm just saying that it's difficult to recruit people There's an energy around small groups that really would have an opportunity to mobilize those people into a force. It enables them to hold themselves accountable for positive change. But I'm just giving my advice as it relates to how difficult it is to bring people to the table. And what I would recommend, because I think this is a magnificent idea, but what I recommend is that you try to create some template based on the recommendations and what's been stated here, and then figure out different ways to give it a go. One of the ways, I always refer to someone, I think Ethan, you said, referred to it as community champions. Well, there are people that reside in distressed neighborhoods who want change. And they are our greatest resource. But we just have to draw those people out and figure out who they are and join them. We have to join what they're doing and have them join what we're doing, and we marry those things together and then move forward. But I suggest that we work on some sort of a template and then come up with a plan as to how we can sort of try to come back later and implement this over the next month or two and give it a shot.
So my question is, I've heard through the sessions that this is ours. This is not the city's, right? So we need someone of our team that would help craft that template, kind of crafting what that strategic plan is, the step-by-step, who collects the data, holds it, owns it, whatever, and then for us to be able to use it. So Randolyn, is that a United Way function?
Yeah, yes. A resounding yes. Happy to lead this and use you all as help.
And you know what, Randolyn? I know Courtney sits on the CHIP leadership team, and that's the Community Health Improvement Plan. Not familiar with it. So I think either August or September. And I think that it would be really at that meeting, the leadership team is going to have a chance to give their input on the draft of the CHIP, which already has objectives from the people who were kind of leading the CHINA process. So I think it'd be great if before then, if we have kind of an idea of what this would look like, if we were able to insert some of this into our community-wide community health improvement plan, it kind of gives some teeth and some sustainability to whatever comes out of this group. So maybe Courtney can bring that forward to the group.
And I have an idea. Mayor, piggybacking on what you were saying and obviously what everyone is saying, but one thing that we can start is first with social media. We all start a hashtag that's exactly the same, something like what Ethan was saying, equity ears. Maybe we can find something a little bit more catchy that's going to draw the kids. But something like that. And then also each individual that's on this call right now, if we can come up with a group of 8 or 10 people that we have met that are looking for change, or everybody's looking for change. They may not be vocalizing it, but everybody's looking for something. Now, if everybody that's represented on this call, that's already 100 or 200 people that we have now formed from just this small group. Now we have expanded to 200. So by word of mouth, we begin speaking, starting from, and everybody is now tagging with that same hashtag. It becomes bigger. That hashtag grows. Now we're growing more people to the group. And we can put things out in the community of t-shirts, hats. You have to build a brand. Exactly, Randolyn. Build a brand with this initiative that we can grow just by this mayor's initiative call, because we're starting change. And it starts with us on this call, and then social media, and then in our homes, table to table,
And then we all come together collectively. We can go to a community park. We can all decide to meet at a church. We can meet at the city hall or something. Just make it like a once per month forum where we all are face to face, just saying, hey, this is a name to a face, and we're gonna, come together and break bread together, like Bob was saying earlier. But we can put all the ideas together, and it will build more of the segue that we're looking for.
Excellent. Mayor, we can't hear you. Go ahead.
I do want to say that it's important that we realize that this work surrounding equity, and this is a mayor's initiative, but it belongs to the community. And that was the way that I have always intended it to be. But we have essentially four other groups, 9 other domains, if you will, education, K-12, that sort of thing, and criminal justice, police, law enforcement, clergy. So it's different. I don't know how, because I don't want them to, I want this group to focus on what's important to you, but I want it all to be under, at the end of the day, I want Daytona Beach to be a model community for equity. That's my goal. That's really my goal. How do we become a model community of how to express equity in our city? So I would like it to be something that ties, if we created a hashtag, I would prefer it to be something that ties our city behind the agenda, and it's able to use all of the other groups, so everyone's able to use the same hashtag.
Maybe something like Daytona Speaks, something like that. I'm just throwing that out there. It doesn't have to be, I'm just saying something in that general area, or Daytona. I'm not sure yet.
I have no clue. I'm not a brander, but that sounds good to me, but I'm not the one to brand.
I think Daytona listening might be better than speaking if we're soliciting opinions or input.
Yeah.
Let me look to see what's all available. One moment.
But also think about it beyond just it being something where we're just listening. Because at the end of the day, our goal is what?
Action, yeah.
It's action, but it's action around equity.
Right, and changing
What
policy.
about Daytona for all? Daytona number 4 and then all.
Or make Daytona yours.
Well, I'll share with you all, in my computer companies, I always got marketing experts to figure this stuff out. You can't engineer these kinds of things. It takes creative leaps like you all are having. So I'm going to have to leave that up to you.
Okay. I think we can come back to that, because you still have 4 other groups that, at the end of the day, I would like it to be something that we can use. I really almost want the term equity in there myself, because that's what this initiative is about. It's about Daytona's equity. And I don't want to get away from that, but I do realize you have to listen to people. This to me is an action that we have to take. This is a step. This is a part of our process. But I'm talking more than I like to talk today. But
Daytona United for Equity.
Okay, and then I just looked up the word equity, meaning fair and impartial, the quality of being fair and impartial. So I was thinking maybe Daytona Fair, or fair, or value of Daytona, or Daytona's values.
I'm hearing a lot of excellent ideas. So let's keep working on that. And Lucretia, to the mayor's point, there are 4 other groups, and he wants this to really all tie together. And I know we had some marketing experts on the business call yesterday, so I'm sure they're going to want to weigh in as well. And again, I'll let you all hash that out. But what I've heard so far, well, I really was impressed, Randolyn, by the, the work that you learned. Was it the Hardwood Institute? Is that
Yeah, Harwood, H-A-R, wood.
Harwood? Okay. I don't know if maybe you could share a link in the chat to, that. And, I don't know how the rest of the group feels, but I think if you could bring that body of knowledge to us, that sounds like something that we can definitely build upon to create this sort of template that we're talking about. And so what I'm also hearing is, Randolyn, your willingness to volunteer to kind of take the lead on this, but I think I also heard Ethan volunteer Courtney to help co-lead that with you to some extent from the Department of Health and tie it into the community health needs assessment process and the resulting community health improvement plan from that. Did I misstate that, Ethan, or were you okay with that?
I just don't want to be, of course, I can't volunteer Courtney for anything. I was just saying that it would, as me, I'm more of a facilitator of the CHIP leadership group. Courtney is a member of the CHIP leadership group. So it would be more appropriate and she's Randolyn's boss. So it'd be more appropriate for Courtney to bring that to the group rather than myself.
Yeah, and she would be more than happy to bring that to the table. So,
but in terms of supporting you with data or helping construct or whatever, with the China data that we had before, I'd be more than happy to help with that, definitely.
Fantastic. So what would be the next step then? You're gonna send us information, Randolyn, but then do we get back together or?
Yeah, I think we definitely need to get back together. What I see myself doing is just kind of pulling together the information around the community conversations, I can send that out to everyone or get it to Mayor Henry and he can send it out to everyone. I don't have everyone's contact information on this call. And we can share that and start to think about how we can have these conversations. There's also a smaller list of questions, of a few, like 4 questions that are designed to have one-on-one conversations. So I'll share that as well. But it's all about understanding the needs of the community so that we can start to address some of those needs from their perspective and not necessarily from what we think they need.
Fantastic. Okay. And then Lucretia, I love the social media strategy that you're helping to drive, and some of the hashtag ideas, they sound awesome to me. Lucretia, were you planning to participate in any of the other mayor's sessions, or did you see any of those?
Absolutely. I apologize. I missed the one yesterday. We actually had a Zoom conference call with my church that ran over, so I apologize for that. But I also just looked up a hashtag. Hopefully this will, Mayor, I don't know why you're smiling, but you're affecting my conversation right now. But it's hashtag Daytona for Equity. How does everybody, I looked that up. It's not used right now, so it's definitely available. Hashtag Daytona for the number 4 equity. I tried to put something in there for everybody. Does that sound okay? Thumbs up?
I love it, and I'm laughing because in this chaotic world, please never apologize for missing a session.
Oh my gosh.
but thank you anyway. But I that's what I like. That sounds like what I would approve of.
Sounds great.
Okay. Fantastic. And then and so to whatever extent, Lucretia, you can jump in on the upcoming sessions and maybe share with what we the concept we've had here about engaging the community. In the session yesterday, one of the participants, wanted me to bring to you all kind of along the lines of what the mayor was sharing, is that we ultimately want to bring all of this together, because when it comes to equity, there really are no silos, as we've talked about. Education impacts health, impacts our social being, impacts business, and so on and so forth. So So that would be very helpful. We're kind of coming down to the end of our 2-hour period here. I've just been blown away by the ideas and the participation. Thank you all so very much. Does anyone have any other thoughts that they would like to share at this point, or ideas for how to move the ball forward as quickly as possible?
Just real quick, can I confirm the hashtag was Daytona for Equity?
Yes.
With the number 4.
Yes.
Awesome.
Hashtags are wonderful. My sister-in-law has said that hashtag gray is the new blonde. So I'm letting my hair go gray so I can be blonde for the first time.
Hey, whatever works.
Exactly.
Anyone else? Before I turn it back over to the mayor to close
Do you
this
want
out.
us, do you want us to hold off on using the hashtag until, I don't know.
I don't see why. I don't see why not. I'm going to ask staff to send an email asking everyone to use that and asking folks to begin promoting this as a branding process. You know, just branding. So I'll ask staff to use it and ask everyone who signed up to promote this in social media. Start posting about equity in this way. And I would ask all of you to post if you're on social media based on your experiences and your sentiments today using that hashtag. Let's start.
Very good. Well done.
Is it, can I say something?
Yes, Jenny, go ahead.
Thank you. I wanted to respond to Lucretia, who's talking about wanting to buy some land. I've been, I had this idea and I've been trying to share it around to see how people like it, of creating a housing trust, land trust, building trust, where any citizen could invest money, and this trust would be this big fund that would be used to lend money to local residents to buy houses or commercial property or land, and make the terms favorable to all parties. So
Okay,
I'd love to see that.
I need to send you my information. I would love to know more about.
Oh yeah, I would love to talk about it. It's just an idea germinating in my head, and I'm just trying to find the right people to talk to. So thank you. I'd love to talk about it. I wanted to chime in on Randall's the idea Randallin brought up about meeting outside. I think meeting outside is a great equalizing force. We can meet outside in the parks of different neighborhoods. We can even have a sign of what the meeting is and say, like, everybody welcome. And that's a good way to pick up people. Same as when Mayor Henry knocks on people's doors and gets responses to people's surveys that way. Maybe physically meeting outdoors in a neighborhood is a way to get more participation. And it's also a way for all of us to be together in our outdoor environment of the place we've chosen to live. I think a lot of the social inequity problems have arisen from us getting disconnected from nature in the first place. So connecting better with nature and with each other. And then finally, I forgot to mention what I'm proactively doing. I am trying to proactively encourage my neighbors to grow food and grow shade trees at their own properties. And my wider goal is to promote food growing and forestry as opportunities for entrepreneurship and citywide use of our land very productively to the benefit of all. So thanks for listening.
Well, thank you very much, Jenny. All great comments. And I want to put in another plug for something Robin mentioned early on. Robin, would you remind everyone again about an opportunity to come together for an equity-related activity where we can really have fellowship, but also make a contribution that's planned for later on? Would you share that again, please?
Certainly. Thank you, Bob. So the date is Sunday, August 2nd. Rain date will be the 9th, should it rain Sunday morning on the 2nd. We are planning from starting at 8, depending on the extent of the work that we could do, no more than 2 to 4 hours, you know. I'm hoping, Mayor, that through your office that we could get the word out as to So Trey and I are meeting tomorrow morning to really take an inventory and assess what we could do. And then get the word out to everyone as far as, bring a rake, bring in garbage bags, so that we bring all the tools that we need. And then, I don't know if we necessarily need to have people sign up, but, just show up.
Oh, Robin,
Yes, ma'am.
are you familiar with Volusia Forever or Volunteer Volusia? That's what it's called. And are you, Trey, is this Trey Hanna with the Volusia County
No,
Environmental Group?
Trey's a business owner downtown.
Oh, okay.
He happens to run in, so this is at the Samuel Butts Park
Yeah.
on Bellevue. Mhm.
Bellevue. Okay. Thank you. There is a group called Volunteer Volusia, and they do a lot of park cleanup. And I've been on there, and I haven't heard from them since COVID, but they do a number of different parks all over the county. Pick Saturdays in the
Okay.
morning about that time.
Thank you. I know that one of the other participants yesterday, Pierre Lewis, had recommended that we reach out to the city of Daytona Beach. So I talked with Reed yesterday, and he was going to email me some information as far as how they help coordinate all those volunteers. But with United Way on the call, they can get that out through theirs. The Daytona Beach West Rotary is the Rotary I belong to, so they're always looking for groups as well. But really want this among the 5 focus groups that the mayor has, since we're the ones who have volunteered our time coming to this. And that was the intent of it, was to really get to know each other beyond Zoom, and to show the community who we are, what we're about, that kind of thing. So thank you.
Very good. Well, I think that pretty much wraps it up for us, Mr. Mayor. So I think we'll turn it over to you to close us out.
Thank you, guys. This has been an inspiring conversation this morning, and I'm excited about the potential that could emerge from Randall's suggestion. I do want to share with you all, you guys have pretty much covered everything that I wanted to cover this morning. I do want to remind you that we are going to create a resource page. So everything that you have shared that could be used as a resource will ultimately go on a web page that's attached to the mayor's equity initiative, so that we can go to that page and use it as a resource for information as it relates to this issue. So keep the information and the resources coming each time you meet. And I'm loving this, being able to meet in this format, because it enables us to basically take notes of what we have. We're able to record it. And so continue to bring your resources as we meet. Commit yourselves to being an equity ambassador. That's what we've all kind of committed to this morning. So I don't really feel I need to go through that anymore. Make sure that you, if you work for an agency, try to get them to commit to an actionable agenda. Recruit more people to this process that are in this particular field, health and human services. We have a lot of people who probably want to be here. They just don't know we exist. So let's inform folks and let's bring more people to the table. And the final thing is, I wanted all of this to be organic, and it's truly doing that. I envision that each group will sort of go off on their own and then come back together. So it won't be like, this week I'm doing all 5 sessions this week. But the next time that this group interfaces kind of needs to be determined by this group. And I will help facilitate that through my office, make sure we're emailing and getting the word out. But we, you know, I have an idea about when we'll meet again. But once Randolyn communicates with me and in my office and gets her part done, I will then share that with you all and, you know, give a date that I hope will be convenient for everyone and time. And the times will probably move to later in the afternoon, 2 to 4, 3 to 4, 3 to 5, as opposed to in the morning, because I have other duties in life outside of being a mayor. You know, it's time for me to return to my role as a school administrator also, but I still want to stay engaged. Now, the last thing I want to share with you all is the fact that I am working with a gentleman who's from Daytona Beach, who's creating a platform that I think has an opportunity to be revolutionary. He's working with a city of Tampa, working with universities in developing this platform. And what this platform is that it will help a resident to become the change that they desire to be. We'll give them access to information. So, and I'm going to give you an example. If we've got a young lady who's single and she needs more health care, what we're going to do is we're going to have ombudsman, maybe 10 or 15. They'll go out into the community, much like what Randolyn said. We're going to get everyone that we can imagine to sign up for this platform. Businesses will sign up. Residents, we want all the residents that we can get to sign up. They would put in their information. So in other words, they would say, I'm a 40-year-old single mom of 2. I make whatever amount of money. If they want, all the information they want to give, they give us. This won't be public. No one will know their name. But once they input that information, they might say, I have this goal, this dream. This is what I want. This is what my kids need. Our businesses will put in their information. Everybody put in their information. So after they put their information in, if she says that I need health care, not health care, I need daycare at night, I would then, as mayor, be able to go back in and look at that and see how many people need childcare at night. So if we've got 100 people that need childcare at night, that will inform my decisions as a policymaker. It will also inform a business person's decisions about what this community needs. In addition to that, the fact that we will have all of this information in this, just for lack of a better word, in this database or in this platform, once she types in that that's what she needs, there will be a mechanism to educate her as to how she can get her need met in the community. Another example of how this platform will be intended to work is that if I have a young lady who says that I'm overweight, I want to work out, I want to lose weight, but I feel insecure about working out in a gym. This platform will have a mechanism in place to actually teach her or give her resources as to how she can work out at home. So she can do that in the convenience of her own home. The limits of this resource that I'm working on bringing to our community are unimaginable. And what it does at the end of the day is that it will empower residents to have access to information, to essentially meet the need that they have. Because we're talking about equity, right? Well, that's what this platform's goal is. The goal is going to be to provide people with the resources that they need to meet whatever challenge faces them. So if I've got a challenge, the resource is intended to be in this platform. My hope is that the platform will in some way be ready by November. We will be a part of a trial run of this platform across the nation. It's going to likely take some money, that I'm committed to raising for us to be a part of it. But I believe that it is. We talked about resources. We talked about earlier, will the city put a commitment behind it? Well, not necessarily city resources, but I'll reach out to private industry and ask them to support this effort as it evolves and develops, because I believe it is the perfect example of how we bring equity to our community and how we give residents access to eliminate their experience with inequity. Because at the end of the day, none of us can do that by ourselves. And if we put the tools in the hands of the residents, we say, this is where you go to solve your problem, to work on your goal, your dream. My excitement with this potential, I can't overstate it, but please, be on the lookout and prepare for that. And what Randall, and your idea is precisely what the gentleman describes to me, because this will be able to collect all of the data that any individual gives us, categorize it, put it into a place where we can use it as a community, and we as policymakers, because all of us are policymakers, that was brought up in yesterday's meeting. But it can inform our decisions. So I'm excited about it. I've talked with this gentleman over the last 2 years. I've talked to him maybe 6-7 times for 2 hours a meeting. And so now the project is coming to full light as it relates to the city of Daytona Beach and how it can work in our city. Things are really coming together in a real organic fashion. So in conclusion, I want to encourage all of you to go ahead and be ambassadors. Let's start using that hashtag. And in conjunction and coordination with Randall, I will get out our next meeting dates so that we can push that actionable item forward. Bob, you have anything else as we close?
I want to say thank you so much to all of you for your participation. It's been an awesome session, and thank you, Mayor, for your leadership.
Thank you. Take care.
So long, everyone.
Thank you.
So long.
Bye. Thank you.
Bye now.